Hi, everyone. It's nice to see you again. My name is Becky, and I am with Rochester Mom. And today I am joined by Dr. Melissa Richards. She is the chair of the Obstetrics and Gynecology Department at Olmsted Medical Center. Good morning. Hi, Dr. Richards. Thank you for joining me.
Hi, Becky. It's good seeing you too.
Oh, so we're back. Here we are. We love having these discussions. We are back. And for 2022, we are diving into a topic that I know is extremely near and dear to your heart and something that we all need to be aware of in 2022 in our modern world, knowing our bodies and why it's important for us to know our bodies and how Olmsted Medical Center really comes along with us on our journey towards health, towards being the best versions of ourselves. And that goes hand in hand with knowing our bodies. So today we're talking about well woman visits. So I know, fun topic, well woman visits, AKA your annual physical. Right. So what, a lot of people will ask, is it a well woman visit just a pelvic exam?
Totally. It's interesting to me. We'll take care of women throughout their, childbearing. They have their babies. They see us all the time. And then I'll have patients who will say, well, I'm done having babies, so I'm done seeing you. Or I'll see a woman who's in her late 40s or postmenopausal, and she's like, oh, you're an OBGYN. I don't need you. And I'm like, actually, fun fact. So well woman exam is really looking at, women from a holistic, from a whole standpoint. So looking at screening questions about general health. I like to preface it, if you're seeing an OBGYN for your well woman exam, please know that you're seeing an OBGYN. So we're very good at wellness. We're good at identifying perhaps issues, medical issues. But we also work very closely with our primary care colleagues also, if you're seeing an OBGYN for a well woman exam. But it's really, as I said, an opportunity. Let's check your blood pressure. Let's check other things that we're not always looking forward to, like weight, which we'll touch on in a little bit. But things like, how are you doing from your cancer screenings, and depending on age, where whether that's breast cancer screens, cervical cancer screens, asking about things like how you're doing with bowel movements, how you're doing with urinary symptoms, sexual function is something we talk about. It's really an opportunity to not necessarily come in with a problem. The whole idea is prevention and that, or early detection. So most insurance companies do cover a well woman exam once a year. It is not just a pelvic exam. So interestingly enough, I do a lot of well exams where I don't do pelvic exams. If we don't find any symptoms that warrant a pelvic exam, if you're not due for a pelvic exam, we're not going to do a pelvic exam.
Right. Yeah. Right. So what is the, since we're talking about pelvic exams, what is the guidelines? What is the guidance on women in pelvic exams? How often do women need to have those?
Right. So a pelvic exam is definitely not necessarily a yearly exam. So the importance of in my mind, as long as we're asking the right questions as screening questions, you might not need a pelvic exam. So let's back up for a second. What is a pelvic exam? Because it's this mysterious.
Sure. Yes.
Isn't that just a pap smear?
Right.
So a pelvic exam is doing an external exam, looking at the vulva, looking at the labia minora, labia majora. We're using big words today. We're using $5 words.
We're knowing your body. This is knowing our body. This is good stuff.
Exactly. So looking at the outside, as well as it can be just doing that alone. Like that might be the extent of a pelvic exam that's needed. Speculum exam, people are like, what's a speculum? A speculum is a medical device that we use to actually look inside the vagina and look at the cervix, which is the opening to the uterus. And sometimes that's all we do is we just look. And once again, the tissue looks healthy, the cervix looks healthy. Sometimes we do the pap smear. So the pap smear portion is this. I think a better way to say what when we do that portion, it's the cervical cancer screening test.
Mhm.
Because for some women, we're not necessarily doing a pap smear, we're just testing for HPV, the human papillomavirus, and some women we are doing the pap smear portion of it. But that's also something that's really important for us to explain really well to what we're doing when we're doing that pelvic exam. And then speculum comes out, and then we sometimes, but not all the time, and actually more and more, we're doing less of this, what's called a bimanual exam, where we feel the uterus and the ovaries and the fallopian tubes from the inside and the outside.
Okay.
Yeah.
Yep. So that's a very good explanation of what a pelvic exam is. You know, and a tip that I think you told me about for women who might be like, oh, speculum, feeling for my fallopian tubes. When you are in this position, wiggle your fingers and wiggle your toes. It gives you something to focus on.
Right.
And it also helps loosen up muscles for you when you are in kind of a vulnerable type of position, and our immediate response is to kind of clench a little.
Right.
So these things help us to loosen ourselves, kind of be thinking through getting through it, essentially.
Totally.
So, you know, we talked about gynecology and OBGYN working really closely with primary care. So that leads us into what topic should I say for my gynecologist, and what should I ask my primary care physician?
Totally. So we have different patient populations, especially here at OMC. So we have patients who essentially are what we consider low risk. They have no other medical issues except, you know, they're a lady. And so for those patients, sometimes I am their primary care person. I'm the only person they see once a year, which is great. For that same person, they might use, you know, me for their yearly well woman exam, and they use acute care or urgent care for like strep throat or ear stuff. And then we have other patients who really, they like the idea of, I have my women's healthcare provider who does my breast and pelvic exam, and then I have my primary care provider who does all the other medical comorbidity stuff, which is super reasonable. I like to tell patients we're really good well women, right? And I think I already mentioned this earlier. We got well women down. I'm good at identifying problems. I'm awesome at gynecology. I'm a very good gynecologist, but I'm a horrible primary care provider. Like, like you do not want me doing any of those things. And I will tell you, if someone asks me to look in their ears, I'm like, no, I'm not going to look in your ears, because I don't know what I'm looking at anymore. So that's kind of, patients fall into different buckets, and it's important for us as clinicians to be really honest with patients. And I think it's important for patients to understand, like, we're not experts across the board, but we also have great colleagues that we can match you up with too, so you can have the best of all worlds.
Yeah. So, you know, you're really describing a team. We have a team of people who are advocating for our health and really pointing us in the right direction to be really living to the best of our ability, and to be taking care of our bodies as well as possible. So I love that team approach. So what can someone expect at the well women visit? We've talked a lot about the pelvic exam. We've talked a lot about, you know, that we need to really be looking at these yearly. What can someone expect when they go in for their well women visit?
Great question. So these visits are anywhere between 30 minutes to 40 minutes. And so we're busy humans, and sometimes we save up all of our issues for this one visit. So what to expect? A well woman exam really should be basics. Like I said, you're going to get rooms, we're going to get a blood pressure, we're going to get a weight. After discussion, we're going to ask you a bunch of screening questions about mental health, your family history, update any like medical conditions that have happened over the year. We're going to talk about surgeries that you've had. We're going to talk about, you know, alcohol and drug use. We're going to talk about feeling safe at home. I joke, at least in my practice, that no one gets naked until we've talked. So
Mm-hmm.
in my practice, no one changes until we have had a conversation, especially if I've never met the patient before. And
Mm-hmm.
especially patients where I already am relatively confident we're not going to be doing an exam that involves a pelvic exam. I lay that out on the table right away. Like,
Right.
as of right now, I don't think I'm doing a pelvic exam, 17-year-old who is shaking like a leaf wanting birth control pills.
Uh,
Yeah,
yeah.
exactly.
Mm-hmm.
So after going through screening, and maybe we'll dive a little into like, how do periods work? I like touching on that at my
Mm-hmm.
visits because a lot of people don't understand how periods work. And then usually most women will have one or two things that they want to dive a little deeper into,
Yeah.
which is reasonable. I also
Yep.
think it's reasonable for us, as clinicians to say, this is really important. This is a really
Mm-hmm.
important, your periods have been crazy for the last 5 years.
Right.
I think today, let's do your women, your preventative
Yep.
stuff. And then, you know what? I want to see you again because this is important. And you brought it
Mm-hmm.
up and we need to address it.
Right.
Um, and then after talk, the exam is actually pretty short. Like it
Yep.
probably takes up maybe 3-4 minutes. Most of it
Right.
is chat. Total.
I just had my well woman visit at the beginning of the
Yes.
month at OMC,
Love
and
that.
that was exactly right. It's a conversation,
Mhm.
and my primary care, and I have a health team at OMC. I have primary care and an OBGYN, and that's exactly right. You just described my specific experience. I talk, and they want to get to know me, and they want to get to know my lifestyle and any concerns. And then the exam was like exactly like you said,
Mhm.
3 to 4 minutes. And I love that it really it spoke to me as like just a woman, like my dignity.
Mhm.
You're not just like sitting in a gown for like your entire visit. So that was really, impactful for me. So you mentioned something about, weight. Do you do there's a question that came through that was really interesting.
Mhm.
Do you have to be weighed at a well woman visit, due to past eating issues? This is really traumatic for them. So what would you say to someone who does not want to be weighed?
So typically our nursing staff that's part of the rooming process.
Mm-hmm.
So I think our nursing staff does a really good job of, if a patient declines weight,
Mm-hmm.
no questions
Mm-hmm.
asked. Like we
Mm-hmm.
can address this
Mm-hmm.
in a little bit. So
Mm-hmm. Mm-hmm.
like, I prefer not to be weighed. Okay,
Yep.
done.
Yep. Yep.
And then, I come into the room and it's part of the conversation. I think it's
Mm-hmm.
obviously it's a subject that we all struggle with across the board. I think just in different degrees,
Yep.
right? So trying to understand it, as well as, it does help us when we're looking at trends. It's a preventative visit,
Right.
but I've never forced anyone to step on the scale. That's just
Mm-hmm.
such, to me, like coming in, especially to see the gynecologist, is like such a brave thing to do. Like you've
Right.
taken this time out of your day. Like
Right.
it's a lot of women will actually take the whole day off because they're like, treat myself, because I went to
Yeah.
go get my wellness
Right.
done.
Yeah,
Like,
exactly.
we have conquered so many things to get you through this door that I want to make
Yeah.
sure this experience is like, okay, I'll come back again. All right, this
Right.
so we're
Right. And making
covered.
it pleasant and making,
Mhm.
I mean, not necessarily pleasant, we all know that going to our primary care is probably not like high on our love to-do list, but
No,
making it, changing the mindset around that.
exactly.
So this leads into, and we've got, just a little bit of time here left, but I really wanted to ask this question on behalf of a lot of women who I know that struggle with this. They're scared. They're scared to have an exam. What if something's
Mhm.
wrong with me? What do you say to someone who's really scared to go, just take that step and go in for that well woman visit?
Right. So when she is in the door, like when she's
Mm-hmm.
sitting in front of me, all my worries go away because you're sitting here, you're here. And I know for every one patient who's sitting in front of me, that there are 10, 20, whatever, that are
Mm-hmm.
sitting with those thought processes. So
Right.
I think, knowledge is power. It's empowering, like watching videos like this, talking to your buddies, using the different social media tools. And I think, everyone can do better in getting, the more approachable we are, the more like Dr. Richard, she seems pretty cool. Ooh, I
Right.
watched Dr. Gilman's thing, her video about, this or this on YouTube, or Dr. Klingle's got stuff up there. The more like approachable, I think we know that is in general. I think that helps. Also understanding like you do not, let me look into the camera. You do not need to take your clothes off during it. You could even do your entire, because I feel like that is such a concern. That's one big concern, right? Like that'll be like, no, thank you.
Right.
You don't have to do that. Like we can do the whole visit and you can just decline and we can say, okay, well, this is what I'm thinking with the information I have that we obtained today. So that, and then also like pap smears, like people are really nervous about pap. I haven't had a pap for 5 years. I'm like, well, that's okay. Let's get you in, let's get it done. And then we're all caught up. It's all good. And most like 90+% of the time, everything's fine. It's just like, come here. It's probably going to be a good experience. Like everyone here wants you to have, like, really wants you to have a good experience. And if you're not having a good experience, please let us know.
It's real. It's really all about building that relationship. And when you build a relationship, you build trust, and it makes this less fearful, and more of a mindset like I am taking care of myself, and which we're going to be talking about a lot more this year in our Know Your Body series. So this is just the first one. So if you're interested, make sure that you're tuning in to this series that we're going to be doing with Olmsted Medical Center and Dr. Richards and some of our colleagues throughout 2022. So Dr. Richards, thank you so much for joining us today for talking about this important topic.
Thank you.
Okay, and we'll see you next time.